Are you worried about leg cramps? Well, today I'm going to show you exactly what you need to be concerned about, what are the common warning signs and red flags, and who to go to when you are discovering these signs. My name is Dr. Jeremy Andrews. I'm a doctor of chiropractic here at West Chiropractic in Surrey, and we help people with chronic lower back and knee pain avoid a lifetime of painkillers and surgery. So most leg cramps are typically not a concern. They're usually harmless, and they can often be due to factors such as dehydration, muscle overuse, or prolonged standing or sitting. So they typically resolve quickly with stretching or hydration, and they don't indicate a serious problem. So what do these mean? Well, dehydration, that's often one of the number one causes of benign leg cramps. So a lack of water can lead to cramping, especially when it's hot or after exercise. Number two would be electrolyte imbalances. So if you've got low minerals like potassium, magnesium, calcium, sodium, they can trigger cramps. So this can be after heavy sweating or where people are not consuming enough of these minerals in their diet. Number three would be muscle fatigue. So particularly in those people who haven't exercised regularly or suddenly increase their physical activity, like a weekend warrior, that can lead to cramps. Things like walking long distances, running, working out, that can often cause cramps as well. And then number four, prolonged immobility. So if you're immobile for long periods, like on a flight, or standing up for long periods of time, like at a concert, that can reduce the circulation and lead to muscle stiffness and leg cramps. So top tip, if your cramps typically occur after physical activity or when you're dehydrated, and then they resolve with rest, stretching, or hydration, they're most likely to be non-sinister or benign. But when does it indicate a more serious condition? So there are certain red flags that you need to be aware of. So leg cramps can often be associated with underlying medical conditions that require further investigation and treatment. So we'll go through these now. What are your red flags? Well, number one, if you're getting frequent or chronic cramps, if they occur for more than a few times a week or they persist for long periods of time, it could indicate an underlying health issue. Conditions like peripheral arterial disease, nerve compression like sciatica or stenosis, or some sort of metabolic disorders may be involved. So what to look out for? Well, cramps at rest, especially when you're sleeping. So nighttime leg cramps can occur due to benign factors, but if they're frequent and painful during sleep, that can indicate conditions like circulatory issues or nerve damage. Two, if you're getting cramps with muscle weakness, if they're accompanied by progressive muscle weakness, then difficulty walking or getting up the stairs or any sort of muscle wasting, then this could be more of a neurological muscular disorder like ALS, so amyotrophic lateral sclerosis, or muscular dystrophy. Very rare, but important to be aware of. And then if you're getting changes with swelling on the skin or the color, with swelling, redness, warmth, this can indicate a deep vein thrombosis, so a blood clot in the veins. This is an absolute medical emergency. You need to get yourself to A&E because it can give you something called a pulmonary embolism, which is a life-threatening condition in the lungs. And then pain extending beyond the cramps. So if you're getting persistent pain beyond muscle cramping that goes down the leg, that could be nerve compression issues like, as I said, sciatica or lumbar stenosis. And then if you're getting cramps in multiple muscle groups, like the legs, the arms, the back, it may be due to conditions like hypothyroidism, diabetes, or some sort of electrolyte imbalances due to other prescription medications. What would be the medical conditions associated with leg cramps? So several medical conditions can cause leg cramps as a symptom. So if they're accompanied by other signs or symptoms, that may point to a more serious issue that is going to require immediate medical attention. So let's start with your circulatory issues. Well, we got PAD, so that's peripheral arterial disease. So the symptoms of this would occur during physical activity or walking, but then the symptoms go off when you're resting. This is called intermittent claudication and is a sign of PAD. This happens when you get narrowed arteries, that reduces the blood flow to the legs, and then as they get worse, cramps can occur when you're resting or when sleeping. So really, you need to look at these when they're getting accompanied by leg pain or cold extremities or poor wound healing. If left untreated, that can really increase the risk of a heart attack or a stroke. So important to stay on top of those. The doc, they would do a blood flow assessment through something called a Doppler ultrasound, or they do an ankle brachial index, an ABI test. Other circulatory issue is deep vein thrombosis. This can cause a sudden painful leg cramp, often in the lower leg, in the calf, and that's going to have swelling, redness, warmth. This is an absolute medical emergency because if the blood clot breaks off and travels to the lungs, that causes the pulmonary embolism. So if you're noticing sudden severe cramping with swelling or changes in your skin color, particularly after long periods of immobility, like a long flight or bed rest, then seek medical emergency help with A&E. So they'll do treatment with blood thinners, and that's going to help to thin the blood and prevent any pulmonary embolism. Let's talk about nerve compression. So types of condition with nerve compression are most commonly sciatica. So if you're getting leg cramps in the back of the thigh or the calf accompanied with a sharp shooting pain that's going down the leg, this is often sciatica. So when the sciatic nerve is compressed due to a herniated disc or spinal stenosis, this can cause problems with leg cramps as well. So if you're getting leg cramps with numbness, tingling or weakness, then it's important to consult your GP. They'll do a full neurological assessment, they'll do imaging tests such as MRI or X-rays, and if they're ruling out anything else sinister, then obviously talk to a chiropractor and they can help with that nerve compression and get your body in the best position to help with those symptoms. Second type of nerve compression is lumbar stenosis. That's a narrowing of the holes in the base of the spine. So that can cause cramps, pain, numbness, particularly when walking or standing. And the pain can often improve with sitting or bending, such as when you're leaning on like a shopping trolley. You might see people around Waitrose doing that. They're trying to get rid of their lumbar stenosis. But if the cramps are associated with progressive weakness or bowel or bladder issues, then it's really important to get urgent A&E attention. They'll do, again, some imaging tests, MRI, other neuro tests to ensure that you're not having any cauda equina issues. And then electrolyte imbalances and metabolic disorders. So electrolyte imbalances, if you're getting leg cramps, that could be a sign of imbalances in potassium, magnesium, calcium, sodium. These are critical for your muscle function. So this can occur when you're dehydrated, but also if you have things like kidney disease or other prescription medications. So you need to be worried if the leg cramps are persistent and they also occur with muscle weakness, confusion, or heart palpitation. So this can indicate a serious electrolyte disturbance. So when this happens, the doctors, they'll do blood tests, they'll assess the electrolyte levels. The healthcare provider may even recommend adjustments to your diet or medications. They're going to look for things like diabetes. So people with diabetes can often experience nerve damage. They get something called a peripheral neuropathy. So that can cause leg cramps, particularly when you're sleeping or resting at night. These types of cramps, they're usually associated with burning, tingling, or numbness in the legs. So you need to be concerned if the leg cramps are paired with signs of neuropathy, such as that numbness, pain, loss of sensation. What we'll then do is really manage those blood sugar levels. So it's critical to manage those to prevent any further nerve damage. A comprehensive diabetes management plan that talks about blood sugar monitoring, medication, and lifestyle adjustments to help with those types of symptoms. The second type of sinister condition is the hypothyroidism. So if you're getting leg cramps with fatigue, weight gain, dry skin, cold intolerance, that could be signs of an underactive thyroid gland. So you need to be concerned with this one if those leg cramps are coming with those hypothyroid symptoms. So the doc will do a simple blood test called a TSH test to confirm the diagnosis. And then sometimes they put you on thyroid hormone replacement therapy to relieve the cramps, but it can also be managed with lifestyle depending on the severity of the condition. So most leg cramps are harmless and can be managed with proper hydration, nutrition, and exercise. However, frequent or severe leg cramps, especially when accompanied by other symptoms like your swelling, your pain, your weakness, may indicate a more serious condition. So in these cases, you've got to seek medical advice. It's really, really critical to rule out any underlying health issues and ensure you're getting proper treatment. So if you know someone who is worried about their leg cramps, please share this video with them. Please like the channel, subscribe to the channel for our regular updates. And as always, you can grab copies of my best-selling books here, How to Transform Your Back and The Secret Cure to Back Pain, How to Avoid a Lifetime of Painkillers and Surgery. Many thanks. We'll see you next time.